Thank you. It's an honor to be here at the first Climate Justice Pavilion here at COP. And I'm Nsedu Obot Witherspoon, Executive Director of the Children's Environmental Health Network. And really honored to be here with my friend Jackie Patterson, founder and Executive Director of the Chisholm Legacy Project. So I have a couple things that I was just going to start off. We are very excited about this topic of climate change and children's environmental health, and specifically the intersection between justice and ensuring that all children, current and future generations, have a chance, plus the compounding implications from the environmental injustice that they're facing each and every day. So I first just wanted to introduce a couple things, and then I'm going to make sure I pass over to Jackie, and then we'll introduce some virtual speakers that we have from around the world as well. So glad to see everyone. So for those of you that don't know, the Children's Environmental Health Network is a national nonprofit. We're celebrating 30 years this year. Our mission has always been to protect all children from environmental hazards and to ensure that every child has an equal, just chance at a bright, thriving future. So just to make sure we're all grounded, all children are unfortunately growing up in what we call a chemical toxic soup, which is not very appetizing, but it is the reality. The food, the water, the air that they are breathing really has negative implications when it comes to their exposures when you compare to that of an adult male, for example, where a lot of our policies are set. This is an older slide, but it is very relevant. You can see all of the health outcomes are negative and they're going all the wrong way. So even though the slide is over 10 years old, with a little bit more investment, many more people talking about children, you have to ask yourself, why are we not making the type of systemic change, paradigm shift that's necessary for all children? And of course, there are economic huge costs. So the societal burdens, environmental exposures, health burdens, and definitely economic considerations. Annually, childhood cancer, we're spending $95 million in the United States. Lead poisoning, autism, intellectual disability costs, and of course the costs that aren't even really quantified when it comes to long-term educational attainment for children, especially our most marginalized children. That's just under $5.5 billion. So I had the honor of working with Jackie, and we released earlier this year, Racism That Appends the Cradle, a report that gets into why brown children in particular continue to feel the brunt of not just the COVID-19 pandemic, that's just the latest of systemic, pandemics that they've been dealing with all of their lives, but, climate injustice and just being a child growing up around these harmful chemicals that were never made to enter their little bodies, and I know Jackie will talk a little bit more about that. And I mean, at the end of the day, the climate crisis is potentially the biggest combining challenge that all children are faced when it combines and exacerbates all environmental contributions and considerations that children are dealing with. So we know that 90% of diseases resulting from climate crisis are likely to affect children under the age of 5. So the writing's on the wall, and we are definitely, unfortunately, going in a negative situation for current and future generations. By 2050, 24 million children are projected to be undernourished as a result of the climate crisis. And by 2040, it's estimated that 1 in 4 children will be living in areas with extreme water shortage. So we all need water, food, air to breathe. So this is unacceptable. So what is missing from the conversation? Urgent, focused attention on children, really allowing children, the vulnerabilities of children, especially our most marginalized and at-risk children, to be at the forefront of all policy setting and considerations. And making sure that we're leading with a restorative lens, the wellness, overall wellness and well-being of children, all the trauma and mental considerations that children, even if they're living through traumatic weather events, for example, what is that doing for the life of that child and generations to come? And learning environments, really considering where children are spending a majority of their time. So the Climate Equity Collaborative, for example, is working to combine those nexus of children's environmental health, climate justice, environmental justice in an area we're not seeing. We're not seeing this attention on children, the vulnerabilities of children today and tomorrow, and ensuring that we connect with a private-public partnership and really getting our private industry to not only contribute dollars, but to make sure that this is really an emphasis when we're talking about really leading the climate movement. So we're trying to elevate knowledge. We're trying to unfold those efforts that are already moving in the right way. They're already showing evidence of potential. They're already working to protect children. They're already working to contribute to reducing the climate injustice crisis that we're dealing with. We want to provide more engagement, more on-ramps for those type of organizations, and more funding. and to ensure that we're driving investment, not just for one-offs, but long-term investment in this field, because that slide that I showed, those negative health outcomes, in order to reverse it, it's going to take monumental support and capacity. So we have a children's environmental health movement, and we invite everyone to join this, and climate justice is an inevitable part of this if we're looking at our future. So just excited to join in. These are our kids at home, one of, a few of millions that keep me up and motivated. And now I'd like to allow Jackie to provide some inspiring remarks before we go to some of our international panelists. Thank you.
Okay, good. So thank you so much. It's always an honor to share stage with you and to share space with you all. I was pleased to be able to do this report, Racism That Upends a Cradle, because it really talked about the root causes that as we look at these various solutions and key priorities that Insight listed. We also need to think about this in the context of this greater extractive economy, and where children aren't even being considered, while those who are seeking profits are setting up a system to maintain the status quo, which is one that concentrates wealth and power in the hands of a few. And so from the time that, as we look at Black children in the context of, as a Children's Legacy Project, that our tagline is a resource hub for Black frontline climate justice leadership. So that's the emphasis that we have. And as we think about that work and that emphasis, it is recognizing that children are born into this extractive that Black children were born into this extractive economy in the United States, and that we were born into a situation where our ancestors were brought over in the bottom of ships to be the commoditized first market, the first items to be traded on the market, really. And when I say items, I say that specifically because of the dehumanization and the commodification of our people. And so as we think about the changes that we need to make in order to create the conditions for the very key priorities that Nse pointed out, it really needs to be in the context of shifting our entire economy from one where it's actually designed that there are winners and losers. People think that that there's flaws in the economy, but in the structure of the economy, but no, it's not. It's doing exactly what it was intended to do. That's actually the very purpose of the economy. But in our report, we also talk about the solutions that are already underway, the ways that people are beginning to transform our economy, the cooperative work that's going on, the children-led work, the youth-led work, because one of our principles is letting the people speak for themselves and bottom-up organizing. So we're starting to see the changes that we need to see in the world. We're seeing people growing their own food, people generating their own energy, people ensuring that water is a human right that everyone should be able to have access to. So I appreciate the work of the Children's Environmental Health Network in ensuring that children are centered and children are at the leadership of these changes that we need to make for the betterment of us all. Contrary to the false narrative of scarcity, there is abundance in a regenerative world, and we need to just structure our systems to ensure that everybody enjoys that abundance. So looking forward to the conversation today. Thank you.
Yes, Sister Jackie, thank you. Very helpful in framing, and excited for the rest of this conversation. So our first speaker from Norway is Dr. Kam Sripada. She's an academic researcher from Norwegian University of Science and Technology, who has also done some work with UNICEF. Kam, welcome.
Hi. Nice to be here joining you virtually, and thank you so much for this opportunity. I'm going to give kind of an introduction today to how climate change threatens children's brain development globally. And from what I understand, I'm not able to be there in person, but there's not actually that much focus on children at COP27 this year. And that's not necessarily all that surprising for those who have read the IPCC reports. Amidst all the great science, there's not necessarily that focus on children. So I'm really grateful that we have this opportunity to convene some of us here today that bring that focus, and I really appreciate those of you who are joining. Thank you.
Thanks, Kam. And you can actually get going on your presentation, and then I'll introduce all of you just before your talks, if that works. Thank you. So
yes, the topic of my presentation today is how climate change threatens children's brain development globally. What I wanted to do was, you can go to the next slide, present kind of an overview of how climate change is a health threat. A lot more science on that has become clear over the last couple of years, as well as what are the key points of brain development that climate change is interrupting children's healthy development, and what we are trying to do about that, both through some work that I've done with UNICEF, as well as another organization that I've been part of, ISHI. You can go to the next slide, please. So some of you may be familiar with UNICEF's new climate risk index for children, which came out earlier this year. Next, this shows that around 1 billion children around the world are at extreme risk for climate change. That refers to rising sea levels, to flooding of rivers, to heat waves and droughts. So we're talking about really threatening a big portion of the next generation. Next, please. You can go to the next. This is 1 billion children. Climate change is, we're often seeing in two kind of big categories of what that means. And maybe this is, been talked about a lot at COP already, but this is the sudden events like flooding, heat waves, and wildfires. Next, please. As well as so-called slower onset impacts, things like water scarcity, droughts, shifting agricultural zones where one area that used to be fertile and great for communities of farmers no longer is, leading to migration, changing disease vector ranges. So places where malaria, for example, may not have been prevalent before, start seeing malaria again. People have been talking about, can malaria come back to Britain? It used to be there. And of course, rising sea levels. Next, please. A recent paper in the New England Journal of Medicine recently kind of broke down how climate change actually can affect children's health. So we're talking about heat stroke, air quality, which is, of course, the connection between climate change and fossil fuel pollution, water quality, food supply, as I mentioned, the range of disease vectors, and of course social factors like migration that's caused by shifting agricultural zones, as parents may lose their jobs related to droughts or disasters. Children may be also pushed to go out of school and into the workforce. Next, please. So these health risk factors have been linked with adverse pregnancy outcomes, allergies, cardiovascular disease, brain development related to trauma, lack of nutrition in the early years when it can really make a difference. Next, please. So that's why I wanted to kind of show this in the context of brain plasticity, which is the brain's ability to change and grow in the early years. And brain growth starts early in pregnancy with the birth, the genesis of neurons, which are the main cells in the brain that are involved in thinking. And that's followed by the growth of glia, which are the cells that support the neurons and make connections all over the brain. These are actively unfolding thousands of times every second in this really special window of brain development. Of course, as we start getting experiences and learning, these neurons and cells are making connections with each other. Those are synapses, and those are how we learn. And at the same time, we have myelination, which is supporting and kind of stabilizing all of these connections. And the ones that we don't need, we prune away, the ones that are not helpful for us. Next, please. So you can see that these special periods of brain development we can call windows of vulnerability. So when trauma strikes, when drought strikes and there's malnutrition, when disease strikes, stunting, children are very susceptible to these in these early periods of brain development. Next, please. I was an advisor on this report, which came out earlier this year. I'm not sure how many of you may have seen it, but every year UNICEF releases a report card of the of 45 high-income countries, 43 high-income countries, ranked on a different topic. And this year, they chose what I thought was a great topic, which was children's environments. They called places and spaces. And so they rated countries based on several themes, both the world around the child, like air pollution, water pollution, and lead poisoning, as well as overcrowding, urban green space. They looked at carbon emissions per capita. They looked at how many Earths do you use based on your consumption of resources per capita in that country. Next, please. You can show the table. So that report ranks countries. It's a little bit controversial that countries are going to be ranked on this. I mean, of course, there was a number one country and there was a country at the bottom as well. But the main thing that this report found out was that no country is really doing all that well. All of these rich countries are creating a lot of e-waste generation that's typically improperly recycled, often exported to lower income countries. All of these countries are using beyond their capacity when it comes to how many Earths do you use per capita. Many children are still exposed to air pollution almost universally on this planet. So what this report I hope showed was that there's really a long way to go even in high income countries, which are of course the ones that are most responsible for pollution. Next, please. I wanted to share a piece that I worked on together with ISHI, the International Society for Children's Health and the Environment, which several of my co-panelists are also on. This came out last year. And basically, we state that because of children's special vulnerability to climate change, we as an organization are taking steps to critically reflect on our carbon emissions, critically reflect on when we physically meet, what are we actually researching, what kind of venues do we meet at, when we meet, which is not very often, about once every year and a half. So even though we are quite a small organization, we are international, and we hope that the promises and commitments that we made in this paper can serve as an example for larger organizations when it comes to critically reflecting on members' contributions to climate change. Next, please. And I'd also like to point out another UNICEF program that I co-led the creation of, called Healthy Environments for Healthy Children. Some of you may be familiar with UNICEF's work. It's typically taken a focus on so-called survive rather than thrive. So especially focusing on deadly diseases, malaria, newborn and maternal health. Of course, these are major health priorities, but basically I said environmental health is really missing here. So Healthy Environments for Healthy Children is an attempt to frame some of the most important environmental health threats, including climate change, and kind of steer UNICEF's health programming to incorporate that into their work with health provision and health policy around the world. Next slide. That's it for me. Just a reminder, as the youth say, there's no planet B. Thanks again for your attention.
Thank you so much, Kam. Appreciate that grounding. Our next speaker will be Amanda Mbikwana with the Center for Children's Health of South Africa, founder and chairperson of this nonprofit that's been really exciting to get growing in the South African country. So thank you. Amanda, you're next.
Thank you.
Yes, Amanda, whenever you're ready. Thank you.
Thank you so much. I'm unable to see the presentation clearly, or should I open it from my side? I can see it on your screen.
If you just say advanced, if you say advanced slides, they can help you move through the slide deck on this end, whichever you prefer.
Oh, okay. Thank you so much for the opportunity. I'm honored to be here, as Ms. Witherspoon introduced me. I'm going to talk about change and health of our children. The presentation will cover the impact of climate change on our children, and what is it that we can do, and what is it that we are doing as an organization, and our future plans. Thank you so much. Second slide. The impacts of climate change put almost every child at risk. Climate and environmental hazards are having devastating impacts on the well-being and future of our children. This was the report from UNICEF. Next slide. Who is at risk of climate change? Everyone and everywhere, we are all at risk, but our children are the most vulnerable due to long-term exposure to environmental risks. Next slide. So just to give you a background, because I'm from South Africa, just a background of South Africa in terms of climate change, where we are now. This report was from UNICEF. So South Africa is ranked 72nd in terms of risk in water scarcity, soil and water pollution, having impact on children affected by poverty and poor nutrition. So this climate change and extreme weather like floods and droughts, they impact the health of our children, and also whenever there's floods, it contaminates the water. So South Africa is also a contributor to greenhouse gas emissions. Next slides. What are the health impacts? We have heat-related impacts, such as heat stress, cardiovascular failure on our children, vector-borne diseases such as malaria. We have impacts like water-borne diseases, such as cholera, which is also linked to food supply and malnutrition. We have diseases like air pollution related, such as respiratory allergies, such as asthma. We have mental health impacts. Whenever there are floods, whenever this kind of events occurs, our children are being forced to migrate or being displaced in different areas. So this brings anxiety and psychological impact on their health, and also mortality, which can also result in death and physical harm in this kind of events. Actions to tackle the impact of climate change. What is it that we can do? We can reduce the dependence on fossil fuel. I know it's a long-term goal. We can also build our cities and infrastructures with climate change in mind, use more renewable energy and create more green space. We can also have communities that are designed to promote public health transportation. As you can see from my picture here, protecting our planet starts with me and you. The next slides. As an organization, Center for Children's Environmental Health of South Africa, what is it that we have done so far in these 2 years of existence in terms of climate justice action? So we organized a webinar last year targeted to the early childhood development centers, where we collaborated with South African Medical Research Council of South Africa, Environmental Health Network, to educate the ECD's practitioners about the impact of climate change on children. What is the interplay between children, the environment, and climate change, those challenges and the opportunities. What is our future plans as an organization, since we are still new? So currently our focus is more on the ECDs. That's where we have seen the gap and challenges. Just to give you a background of the ECDs in our country, to say the general household survey that was done in 2020, 25% of children under 5 cared for in the ECD centers. So most of these ECDs, they're in informal areas. They are made with informal structures, mostly with corrugated iron or any scavenged material, poorly insulated or ventilated. So there's a challenge with the indoor air quality that is obviously is affected by poor ventilation, the use of chemicals, indoor cooking on coal, some are using gas and paraffin stoves. Then there's also heavy rains and extreme hot weather. They leave the informal structures vulnerable, and obviously it will impact our children. There's also a lack of knowledge in our ECDs practitioners on the impact of increased indoor temperatures on the health and development of a child. Next slide. What is our support action plan that we are planning to do? obviously we will need the resources on this. So we are planning to raise awareness of the unequal impacts of climate change frontline communities and the need for clean energy, to further community resilience to climate change and environmental injustices, to support our early childhood development centers to adapt to weather changing conditions due to climate change. How are we going to do that? Providing monitoring system for indoor air quality, alternatives cooking methods such as clean energy, indoor air quality monitor to measure temperatures, humidity, and volatile organic compounds, to train these environmental health, to the ECD practitioners in the use of the monitor as early warning system and steps to take to mitigate the results. So my conclusion is that the climate crisis is a child right crisis. So our children deserve every opportunity to reach their full potential, but climate change through their health communities should recognize these connections and improve their decision making to better care for children and implement solutions to climate change. Thank you so much. I will say it all starts now. We all need to start now because the problem is now. Thank you so much.
Thank you so much, Amanda. Appreciate that perspective from South Africa and all the incredible work you're leading. Our next speaker is Dr. Paulina Farias with Environmental Health Department of the National Institute for Public Health in Mexico, also a WHO and PAHO collaborating centers. So Paulina, I know it's very early morning. Welcome.
Thank you very much, Nse, and thank you for the invitation. I feel honored to be here, and I'm very happy to share with you what we've been studying in Mexico, but that is also very important for the rest of the world, I believe. So if I can have my first slide, please. I can't really see if it's on. Okay, I see myself, but I don't see my presentation.
I think they're just loading it.
Okay, great. So I'll just go ahead and start. I'm going to talk about waterborne arsenic and fluoride affecting children's health and well-being, and what we're doing to decrease this risk that is being increased by climate change. So whenever we can see the first one, I'm going to show you that this is a problem that is not only affecting Mexico, but it affects hundreds of countries and hundreds of millions of people worldwide.
There we go.
Okay, great. I don't see it yet. I just see myself. Okay, can I have the next one, please? And the next one. Okay, so in Mexico, what we're seeing here is that around 40% of the population relies on groundwater for drinking. But the problem is that many times this groundwater has levels of fluoride and arsenic that are above the World Health Organization's guideline for drinking water. And this results in more than 6 million children being exposed to toxic levels of these elements. And I'm going to talk about the example of two places in Mexico that have this problem, La Comarca Lagunera and Guanajuato. Next one, please. So those are the two places. And next one. Next one, please. Okay, so I'm going to tell you about how this problem arises. And in arid and semi-arid regions in the world, there has been a growing population, but especially a growing farming industry, mainly for exports, and this requires ever more water. Next one, please. Next one. Oops, can't see that. Okay, so this water comes from the aquifers and is met with an overexploitation of the aquifers. And this in turn leads to increasing levels of fluoride and arsenic that are naturally occurring, that they rise to toxic levels. Can I have the next one, please? And as an example, we're going to see what happens in Guanajuato, but what happens almost everywhere else in the world. And what we see is that the overexploitation does to this naturally occurring levels of fluoride and arsenic. So like in the 1960s, we used to have these shallow wells and few wells that pumped clean water. But then with the Green Revolution, we had to have more wells and deeper wells that reached more mineralized, older waters, deeper waters. And these high levels of fluoride and arsenic contaminate the whole aquifer. So what you see here is that the groundwater is used by more than 700,000 people in Guanajuato, but mainly it's used for agriculture. 85% of the water that is pumped is used for agriculture. And the overexploitation results in more water being pumped than water being recharged to the aquifer. So the aquifer is being depleted by 3 to 4 meters per year. Next one, please. And the rising levels of fluoride and arsenic in the water, when children drink this water, they are exposed to these levels of fluoride and arsenic, and they can have health effects. Next one, please. Can I have the next one? Okay, so climate change makes this worse because there's going to be more droughts and less reliable rainfall. So we're going to depend more on the aquifers, and we're going to be exploiting them. And fluoride and arsenic are going to be rising more, and this is going to be toxic not only for the people, but also for the crops. So this is going to result in less crop yields and less crop choices for the farmers. Next one, please. And inorganic arsenic and fluoride have a myriad of health effects, each one does, but they also have effects in common, like the ones you're seeing here, and we're going to focus on the neurologic and cognitive effects of both fluoride and arsenic. Next one, please. And what we studied in Guanajuato was that the fluoride levels in the drinking water of every source were above the World Health Organization's drinking water guidelines, except for the water that came from rain harvesting. Next one, please. And when we compare the dose of the fluoride that comes from these water sources and the dose that is associated with a 5-point IQ loss, we see that children that drink rainwater are okay. Their dose is below that reference dose. But children that drink water from the wells, which comes from the aquifer, are drinking twice as much that reference dose for fluoride and are thus at risk of losing 5 points of IQ, of potential IQ. Next one, please. And this water fluoride is very strongly associated with their urine fluoride, meaning that this is their main source of exposure to fluoride for these children. And children who drink water from the aquifer have a mean fluoride level in their urine, which is more than 3 times than the urine fluoride of children who drink rain-harvested water. Next one. And this urine fluoride is strongly associated with the IQ of the children. As their urine fluoride increases, their IQ decreases. Next one. As for arsenic, what we saw is that in 90% of the 31 sampled wells, we saw arsenic levels in the water that were above the World Health Organization's guideline values. And this translated into a 97% probability of presenting non-cancer effects in children, such as losing IQ points, and up to 6 children in 1,000 being at risk of presenting cancer associated to arsenic exposure. Next one. And this is extremely high. And we also evaluated the economic and well-being impacts from drinking these high levels of fluoride and arsenic in the water. So we've already seen that this arsenic and fluoride are associated to a decrease in the IQ. Next. And this is going to result in poorer prospects for the children because their schooling and their employment and their earnings are going to be impacted, negatively impacted. Next one. So this is going to translate into, for instance, 1 point of IQ will decrease at 2% in their per capita income output. Next one. So we modeled the health and socioeconomic impact of 3 water table scenarios over 100 years. 1, that the aquifer recovers, 2, that it remains a steady state, and 3, that depletion continues, which is the most likely to happen. Next one. And our results show that recovery of the aquifer by diminishing the pumping rates is not realistic because it would take centuries to recover. Next one. And if the aquifer pumping rates increase, which is the most likely to happen, the arsenic and fluoride levels would increase to levels associated to a 6-point and 7-point IQ reduction, respectively. Next one, please. And what we're seeing right now is that the children have an average IQ of 77 points, which is quite low. And in 100 years, if this continues, we could see an average IQ of 55 points, which is well above a challenged IQ. Next one, please. So our options are mainly preventing and mitigating exposure to arsenic and fluoride and their effects. And the water treatment is costly for the individual. It's around 5% of the household income, but we are seeing a generation for the individual and for the state, even though this high cost, the return is higher. So this is our option. Next one, please. So in conclusion, next. Next one, please. The next one. The aquifer overexploitation is resulting in farming industry reaping the benefits, but the children are showing the health and well-being risks. So these high groundwater arsenic and fluoride levels are causing health and well-being risks, but they are preventable, and not only that, but they are also economically convenient to prevent. Next one. And the population is not responsible for the problem. They are not using that 85% of the water. They are not causing the overexploitation, but they are responsible for their current solution. They are rain harvesting the water in order to be less exposed. Next one, please. So what we really need is more involvement of other stakeholders in long-term solutions. Next one, please. And that's exactly what we're doing in our new project, which is an interinstitutional, interdisciplinary project involving not only the population, but also farmers and decision makers. And what we're introducing now is not just the rain harvesting of the water, but also longer term solutions like centralized water treatment, which is expensive, but as we said, is actually less expensive than the consequences, and also diminishing the aquifer pumping rates, which is going to be beneficial at a very long-term solution. And the farmers are also being encouraged to grow higher value crops with a lower footprint. Next one, please. So I'd like to acknowledge our funding agency and my collaborators, and thank you very much for your attention.
Thank you so much, Paulina.
Thank you.
I hope you're listening for solutions and some best practices that continue to be lifted up by these incredible presentations from around the world. And I mean, bottom line there, contaminated groundwater due to increased drought conditions, increased cancer risk, decreased IQ points, just to name a few. I mean, doesn't get any more basic than that and vital. Thank you. And our final presenter, before hopefully getting into a little bit of conversation here, is Dr. I. Leslie Rubin, Associate Professor of Pediatrics at Morehouse School of Medicine and with the Southeast Pediatric Environmental Health Specialty Unit at Emory University in Atlanta, and also with Break the Cycle of Health Disparities Incorporated. Thank you, Leslie. I know it's something like 2:30 a.m. for you, so sorry about that.
Good. Thank you, Nse, for inviting me to this very, very important forum. And thank you, everybody, for your excellent presentations. And what's been good is that I've been able to sort of capture what you started saying, and I hope that I will build on what you've said. I'm going to talk to you about climate change in children's health and also children's health disparities. Next slide and next slide. So skip one and go to the next. Okay, next. Children are uniquely vulnerable next to their environment, and poor children are more vulnerable to their environment. Go 3 slides ahead, please. Okay, everyone's talking about, different health aspects, but the ultimate measure of the health of a group of people is the infant mortality. The infant mortality is the number of deaths per 1,000 live births. And in this slide, it shows that on the bottom are the infant mortality rate for wealthy mothers, and on the top are the infant mortality rate for disadvantaged mothers. And this is in the US. And the disadvantage really relates to poverty. And you can see that the infant mortality rate is double that of the wealthy mothers. Next slide, please. 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 Okay, stop. All right. Now, the reason I'm saying next slide, please, is when I prepared this, I had full control over it, so I could sort of say when each one was coming next. But what I want you to look at here is the third point down, which says 31% of heat-related illnesses, such as dehydration, electrolyte disorders, are seen in emergency rooms during warm seasons. This is just warm seasons. This is not just heat, but this is warm seasons in the US, and these kids can die from these disorders. Next slide, please. In the more urban areas where there's buildings and asphalt on the streets, you have increased heat reflection, and the temperature can be as high as 7 degrees greater than it is in the more green areas surrounding the cities. Next slide, please. This is a very telling slide because on the right-hand side is a picture of Oakland, California, measured by income rate. So the darker the green color, the higher the income. And as you can see in the top right, there's a very high income, and on the bottom in the middle, there's a very low income. On the left is the surface temperature, and if you look, the red color, the darker the red, the hotter the temperature. And if you look at the corresponding areas in the top right, where they were the most affluent population, they had the coolest temperatures, and the bottom left, where they were the most least affluent, the poorest, was the highest temperatures. So we can see that there's a great impact of climate on poor children. Next slide, please. And if we look at infant mortality, another measure, a measure of well-being, the greatest infant mortalities in the world are found in Africa. Next slide, please. And this is a slide from researchers actually in South Africa who measured the infant mortality in Africa related to climate change. And they found that the infant mortality related to climate change is double, more than double, what would have been expected without climate change. Next slide, please. And this is a map of the surface temperature in the world. And as you can see, that same region in Africa that had the highest mortality has the hottest temperatures. Next slide, please. And that is the Sahel region of Africa. Next slide, please. And this area has temperatures that are 1.5 times greater. Next slide, please. Next slide. And this is also associated with droughts and floods becoming longer and more frequent. And the United Nations estimates that roughly 80% of the Sahel's farmland is degraded. Next slide, please. Next slide. Thank you. This is just a picture of the Sahel, a farmer, a herder, somebody who depends on livestock. Go back one, please. Thank you. He depends on livestock for his livelihood, and the livestock represent food for the people. In addition to these droughts affecting the grazing of these animals, it also affects agriculture. So we're having decreasing agriculture and loss of livestock. Next slide, please, leading to food insecurity. Next slide, please. And in these areas of the world, next slide, please, these areas of the world, there's not only the impact of climate change, but the cumulative impact of conflict, political and armed conflict. Next slide, please. And as a result, next slide, please. As a result of this food insecurity, the people leave the countries. They go and look for food and look for safety. And if you recall, a couple of years ago, there were dramatic stories of Africans trying to cross the Mediterranean on rickety boats and drowning at sea and being prevented from reaching the European mainland. And that was because of droughts and these armed conflicts. So it's cumulative. Next slide, please. The United Nations Refugee Agency estimates, this is from 2019, I'm sorry, that 79.5 million people were displaced, and today it's 100 million. And next slide, please. If you look at the bottom right-hand corner, it says 80% of those who are migrants or refugees at this moment are related to food scarcity, food insecurity, and malnutrition. Next slide, please. And the estimate is that, and this is the United Nations estimate, 1 in every 8 migrants worldwide is a child. Next slide, please. And children are much more vulnerable to abuse, exploitation, violence, detention, and trafficking. And this is even more so if they are unaccompanied. Next slide, please. I just mentioned, increased temperatures, but we know that the increased frequency and intensity of natural disasters, floods, hurricanes, droughts, extreme weather events, and wildfires. Wildfires, I mean, in Siberia and Alaska. Man, who would have thought that we'd ever have wildfires in Siberia and Alaska? And most recently, this devastating flood in Pakistan just about a month ago. Next slide, please, which has affected, I think, about 16 million children. Next slide, please, with about 100 million children, 10 million children still left in need of life-saving support and at risk for waterborne diseases, drowning, and malnutrition. Next slide, please. It's estimated, next slide, please, that 175 million children per year are significantly adversely affected by natural disasters, and they bear 88% burden of climate change. And the bottom line is that the poorer they are, the greater the burden. Next slide, please. Our task is an urgent one. We need to take action. Next slide, please. We need to take action because we need care about our children and the future. And it's for each of us to play a part, and each of us can play a small part or a large part, but we each have to play a part. Next slide, please. Our plan, next slide. Our plan is to examine climate change in terms of cycle, where on the top right, you'll see a healthy planet. After industrial revolution, we get all the anthropogenic effects of climate change and the adverse health outcomes. But in the top left-hand corner, we can restore healthy environment. And this is our plan. Next slide, please. We plan to work with the youth to develop projects that will break the cycle of climate change and restore healthy environment for our children, for our future. Next slide, please. This particular model is based on a program that we've had going for almost 2 decades. And next slide, please. Our program was called Break the Cycle of Children's Environmental Health Disparities. And what we do is we recruit bright, creative university students to develop projects that will break the cycle. And then the students present their projects at a conference. They write up these projects for publication. And these students then become our future leaders. Next slide, please. I'm going to give you an example of the particular cycle that we use. It's a cycle of environmental health disparities. Next slide, please. This is a cycle of environmental health disparities and is based on social and economic disadvantage, and it sort of looks at where people live, where they the disadvantage they have environmentally and socially and economically. And next slide, the adverse health outcomes in mental health, physical health, adverse pregnancy outcomes. And we'll go through a sequence of the projects that happened this past year. Please go through 6 or 7 next slides, please. These are the slides these are the projects that we had from this past year. One more. And now one more slide, and this is how they break the cycle collectively. Each project together, cumulatively, can break the cycle. Next slide. So we have had 17 annual cycles. We've had 150 students. We've had students from 21 states in the US, 50 university departments, 6 from countries in Latin America, 2 from countries in Africa. Next slide, we've published 13 journals, and each journal like this one has all the papers from each year, and we also publish books. Next slide, please. This book is the first one we published on maternal and child health, and then the next one is the last one we published, next slide, on environmental justice. So, next slide, please. We can make it happen. Next slide. We can try to restore a healthy environment. Next slide. Go back, yeah. For our youth, for our future, for their future, and for our future. Next slide, please. Next slide. Okay. So our children, youth tell us that their future is in our hands. Next slide. And though we may not be able to complete the task, we're not permitted to desist from undertaking the challenge. Thank you very much.
Thank you so much, Leslie. Break the cycle of climate change. This is what we're talking about. It's not okay that for decades, children have continued to become our indication of how badly we have been doing for them and not rising to be the stewards, responsible adults that we need to be. So how are we doing on time for Q&A? Okay, good. So let's have a little discussion here. I mean, the bottom line, our organization has been at this 3 decades. We have research. You're hearing just a little bit. There's a plethora of research in the field. There's a little bit more investment. There's a lot more people talking about children. Why are we not breaking this cycle? Why are we still allowing, knowingly now, we can't even claim ignorance, our children to be exposed to the harmful chemicals first, the atrocities of the climate crisis, and then all the other economic and mental health dilemmas that they and their families and their communities then burden. Jackie, for starters, and please everyone else jump in, what do you think it's going to take to have the type of paradigm shift to change the direction of those negative health outcomes for children?
Thank you. Yeah. I think that these stories, I think that we need to shift the narrative and begin to, just as we did in our paper, but otherwise to think about ways that we lift this narrative so people actually understand. Because people do care about children. People do, and they need to understand how much we are endangering children and how much we are putting children in peril by direct action and by neglect. And I think if people understood more, we could actually build the political will. We have to show not only the peril, but also the promise and what's happening that's actually improving the life and well-being of children. So lift up the crisis that's at hand, but also lift up the pathways that people are already beginning to pave for transformation, so that people don't feel just overwhelmed and powerless, but they actually see that there's a way to make the change. So I'm
excellent.
Sure
No, that's definitely in line with what we've been finding too, right? I have yet to run into anyone that admits that they're not interested in protecting children. We are up against a lot of very important issues just at this convening alone. I'm wondering about our panel. Any other thoughts on how we truly garner and collect that political will necessary? I know we're all in different political systems, but what are you seeing as far as, strengthening our alliance, which we're trying to do here globally on this field? Anyone have an interest in jumping in?
Yeah, can I go ahead?
Please, yes.
Thank you. So, for instance, what we have been measuring, which is the IQ, is very hard to see because it's potential IQ that you're losing. So you're saying, is nobody wants to hurt children, everybody wants to protect them, but it's not so easy to see it sometimes, or people don't really want to believe it, and it's not easy for the population to see. They're not reaching that potential they could reach, and authorities don't see it either. So what we're doing right now is also measuring their kidney biomarkers, and that is something they can see more easily, and they can see how they recover. So we're trying this strategy now because even though we know this is hurting them, when we give them the facts and when we show them that this can get better, we believe this is helping. This is helping everyone, the population and the authorities, to try harder to make a change.
And that notion, and it's true that treatment costs a lot more than prevention. Not just the social benefits and the health benefits, but economically, it just costs less in the long run. So totally agree. Lifting up what is happening, what is moving. Clearly, these are a few examples of some exciting things happening across the world. I think we're down to our last few minutes here. If you could all take maybe under 30 seconds, we'll just go around, including Jackie. What is one action that you would like to impart with our audience today? Okay, we have a little bit more. Okay, well, I'm going to go to another question then. The challenges. So we're agreeing that children are, a no-brainer issue here. They've done nothing to contribute to how we got here, and yet they're feeling the brunt, especially our most marginalized. How do we overcome? How do we overcome these challenges? So let's face it, in the United States, for example, people know we've been working at this. Many people have been working at this, and yet still our gross domestic product, for example, is under 10% when it comes to anything related to children, education, and whatnot. That speaks volumes. So any suggestions here on how we overcome these challenges in thinking, the challenges in competing with other important needs? We're all kind of seeing it. It sounds like we thread the needle as far as what is the alternative. But, any suggestions in your experience about how we overcome the challenges, the barriers that have prevented progress in a much more exponential way?
I can follow up on what Paulina mentioned, which is the importance on gathering data about the impacts on children of climate change and disaggregated data where we're also oversampling populations that are most affected, data on children and data on children's health. I think that a lot of times when that data is missing, it becomes invisible in the policymaking phase. Like you said, Nse, a lot of policies about, tolerable threshold levels for different chemicals is based on an adult man, and children's bodies and physiologies work in a totally different way, and they're much more sensitive to climate change and to chemicals. So including disaggregated data when we're collecting climate change effects on children. I think another thing is looking at adaptation. Paulina also mentioned the rainwater harvesting. Can we identify these best buys and scale them up? I think that the different organizations that have been mentioned here today, both Amanda's and Leslie's work as well, how can we take this great work and the great work that the communities are doing and scale that up? And the last thing that I would mention is also about healthcare facilities. How are these being adapted to, as Leslie mentioned, more children are coming in with heat-related complaints in simply warmer seasons, let alone heat waves. Some hospitals, especially in more tropical countries, are developing guidelines for heat stroke, for malaria outbreaks that may be seen in places that didn't have them before. So the health sector needs to also play that role in adapting into a new climate that we're seeing.
To lift up that you haven't already. Leslie. I think you're on mute. Yeah.
Yes, I was. It's messaging. How do we get to the people who need to hear? And I think that what we just heard are so critically important elements in protecting and assuring the health of each child by reducing pollution, by educating healthcare professionals, educating educators to be aware of what the health impacts are and how to prevent them. The second aspect is how do you reach a broader audience, because we're looking at the end point. This is exactly what's happening in. Where does it all come from? And I think Jackie made a very chilling set of comments right in the beginning that there's a lot of kind of infrastructure or structural, I think you could call it structural racism to some extent, but it's these structures in place that perpetuate this. And we have to reach the people in power. We have to reach the people who can make a difference, the people who can say, hey man, let's cut the emissions, let's educate children, let's make sure that everybody's healthy, let's make sure that we protect our water sources. We've got to reach the people who make these top decisions. And one of the ways I think, and we're looking at a movement that's kind of global. And when you ever you look at this, you got to move a lot of different pieces, a lot of different levels, a lot of different stages. So it's not just one thing. So many, many, many things have to happen. One of which we discussed was educating children or stimulating and inspiring children to make a difference. But what I'd like to do and what I'd like to suggest is we have a look at like the impact, the financial impact. If we look at, and I think Jackie mentioned this in the beginning, if we look at what the costs are of natural disasters cost billions of dollars each. And if we could do something to prevent that, we could save billions of dollars. But you have to spend the billions of dollars in the beginning, and spending billions of dollars for something that you don't look and see and touch immediately is short-sighted. I mean, it's investment in the future, but for people who don't do this, they very short-sighted. They only look at what am I going to see tomorrow? Will my stocks go up or something like that? We really have to re-examine, redo, re-educate our leaders, our government leaders, our business leaders, and they have helped this world to become a better place, because there are some great improvements that have happened, but we're reaching a tipping point. And Gutierrez said it when he said, we're rapidly approaching climate hell, and it's in a very short period of time. So there's absolutely dramatic urgency to this message that we're trying to get across, and the message that COP27, I think, is trying to make. And our focus is on children.
Thank you, Leslie. Amanda, quick action.
Thank you, Ms. Witherspoon. I agree with all the speakers. Children's environment, health, and climate change is, just speaking from a South African experience, it's not really known, and we don't have the policies and the strategies. So, and people at the grassroots level, they are mostly affected. They understand that children have rights, but when you come to them and speak to them about children's environment health, they don't understand what is that about. So we are currently actually working with government, and we go into communities to educate them about this children's environment health. And even our own environmental practitioners in our country, you cannot believe it, they do not understand what is children's environmental health and climate change. They are not, this is not even in the curriculum of their bachelor's degree going further. So we are working with our National Department of Health to look into the policies of what is it that we can incorporate into the policies to protect our children from all these environmental hazards, including climate change. So we really need to educate, as Leslie said, we need to educate our leaders, our politicians, our communities, and work together in order for us to protect our children. It's speaking from South Africa's point of view, we have a lot of work to do. We still have a long way, and I am glad that we are learning from your organization as Children's Environmental Network. we are learning a lot, actually, because we are just 2 years old and there's too much work to be done. We still have to meet our leaders in the government. We still have to meet our politicians, but we are ready for that in order to protect our children and also train our ECDs practitioners, train our EHPs further. And we are also planning to introduce these children's environmental health into the curriculum of our environmental health students at the universities. So I agree with everyone. We have to do it now. We have to do it and collaboratively. Thank you so much.
There's a lot of resources available. We need to move that into action, especially getting in front of change makers and influencers for sure. And Jackie, any last thoughts before we wrap up? I don't think we're going to be able to get to Kim. At least they were able to respond to some of the other questions. So,
okay. Yeah. Well, yeah, no. I mean, I just echo what everyone said, and I would also just say that in order for us to enact all of this, in order for us to advance all of this, we have to de-link the moneyed interests. So whether it's the halls of Congress in the U.S. or other places, or it's here where children's voices are so small and it's a pay-to-pay situation. Even this very pavilion we're sitting in, it took a lot of fundraising to even be able to have this space for climate justice as the first space for climate justice. So we really need to work on putting the power of the power in the hands of the people instead of the profiteers.
Yes. Jackie, thank you. So many of us here are trying to build a global children's environmental health network. We learn so much from each other. We're stronger together. Our political structures may not be the same, but there's so much value add in sharing, learning, overcoming challenges, giving each other support. So that's something that we're trying to grow. These are a few of those advocates and leaders, and we very much value you all very much. Jackie, it's always a pleasure. And again, thank you for your attention, and please continue to think about children, put children first, and ensure that we're not forgetting them in the climate action plans and other actions happening in your localities. Thank you so much.